Good afternoon, everyone. Unfortunately, it's yet another sad day for the island as the coronavirus spreads and has taken more members of our community. This morning we heard the very sad news that the island has now had its third and fourth coronavirus-related death. Our thoughts and condolences are with their families and friends during this difficult time. Since this morning's update, there have been 2 further confirmed positive cases for coronavirus. The total number of confirmed cases on the Isle of Man is 258. There have been 2,244 tests, 2,089 concluded tests, 155 people are awaiting results, and 69 people are awaiting tests. In total, 90 individuals have been instructed to self-isolate, and 13 are now being treated at our hospital. The contact tracing process is already underway, led by Public Health. In total, 151 individuals are presumed recovered, and there have been a total now of 4 deaths caused by the coronavirus. Yesterday it was announced that due to the developing health situation, the current restrictions on work, movement, borders and our social lives would be extended until at least the 23rd of April before they were reviewed. The emergency powers have been extended into May. We are all having to endure this period of uncertainty, some far more than others. During the time when most of us are confined to our homes, it is often the small things that we missed most. The Isle of Man government is working to try to bring our beautiful island to you via your phone or computer. You may have already seen that we've been working with the staff at the Curragh Wildlife Park, and each day this week the park has opened its virtual gates to give an insight into the life of its inhabitants. There are 5 short films from the wildlife park covering some of their star attractions. The park's knowledgeable keepers explain a little bit about the animals, where they're from and what they eat. These can be seen via the government's social media channel. Already featured this week have been the lemurs, meerkats, penguins, the now famous Kush and the other red pandas, with 1 or more to follow tomorrow. If you haven't had a chance to see these yet, please do. I think they've done an excellent job and produced some really educational videos for adults and children alike. All the park staff and volunteers are looking forward to welcoming you back after all this is over. But until then, you can sit back and enjoy a little reminder of life at the park and the wonders of nature. I'd like to thank all the staff across the whole of the education service for volunteering to keep our hub schools open over Easter, so that our key workers can continue their valuable work and vulnerable children are continued to be supported. I'd also like to thank the nurseries and childminders who have continued to support our frontline services. Our children's education is vitally important, and I've heard many stories this week of how parents are continuing to educate their children at home. Schools are working hard to maintain the link with their pupils. Some have taken to supplying home learning suggestions and activity packs, ideas on how to get creative at home, and have created online educational resources. These are all great things that will help bridge the gap until we can return to some form of normality. One part of school life we mustn't forget is the social interaction each pupil would have got at school, and while continuing education is important, equally important is being able to relax, socialise and interact with others. As parents, you don't have to become the teacher figure. Your children need you the way you are. Play board games, do a jigsaw puzzle, read a book with your children, but also try to ensure that they have time to speak with friends and family over the phone or internet and are able to discuss the issues and feelings they have with you. This can alleviate some of the anxiety that children and adults alike will be feeling and help protect our mental well-being. Earlier today I spoke with a number of young people and invited them to ask any questions they have on some of the things that affect them most as a group or on a personal level. I tried to honestly address some of their concerns and thoughts about the coronavirus pandemic. This was done online and recorded. We will look to make this available as soon as possible. It's important that we encourage young people to express their feelings, emotions and fears about the current situation. and also get involved with what's happening on the island and what's happening with government. When you have a chance to watch this, I think you'll agree there were some really great questions, and I would like to thank Emma, Ben, Cara, Ethan, Greya, James and Harry for taking part in the discussion, which was both interesting and insightful for me, and I hope the young people as well. I'd now like to answer any questions from the press and start with Isle of Man Newspapers and Sam Turton.
Good afternoon, Dr Allinson. I just wanted to start then with schools. In England, the conversation starts to move towards when schools will start to reopen, if there's the need to keep them closed, and also what may happen in regards to the summer holidays. Have those discussions been taken on Ireland? At what stage are they at, and to what degree are the teaching unions involved in these?
Okay, I mean, you've hit the nail on the head there. Schools aren't just buildings, they're the people, the staff that keep them open. And before we start embarking on conversations about opening the schools, we need to talk with the staff. They have their own issues, their own fears about opening up the schools again. What we're doing on a day-by-day basis is looking at the healthcare situation on the island. And when we get to the chance where we think we can start loosening these restrictions, obviously getting students back to school is one of those, but this will have to be done in a very gradual, graded way, taking on board those staff, making sure we do the right thing at the right time, and making sure we do that together and move forward. So I can't give any timelines at the moment, and I shouldn't, because we need to have that consultation, we need to have that dialogue, and we need to make the right plans both for the staff and the pupils and their parents so we can move forward together.
Sorry, just to clarify before we move on, is the issue there about the summer holidays which has been brought up in England as well?
Yeah.
In regards to what this might do to the actual school calendar itself?
Yeah, I mean, we haven't had that conversation yet. One of the things I was talking with younger people earlier on was about some of the practical assessments they need to do to get their degrees, whether that be A-level or BTEC. And certainly I've been working with the Isle of Man College to see if we can open the college during the summer to allow people to catch up so that their education isn't interrupted, they don't have to resit. But there are also other options in terms of those people who want to sit their exams, perhaps being able to do it later on in the year. So we need to have that conversation with the schools, with the teachers, to see if we can provide the right facilities and the right education to allow people to catch up and carry on with their education so that it's not interrupted and their future isn't set behind.
Yeah, just secondly then, we obviously the government has taken over at the school care home, and we're now getting confirmation that 20 residents and staff have been confirmed positive for COVID-19. Now, while not questioning the professionals of the staff, something has clearly gone wrong there. Are we able to say at any point where mistakes have been made, and also how we are being sure this is not happening in other care homes around the island?
Yeah. The situation at Abbotswood is developing, and we're learning more about it as we're supporting both the staff and the people who are resident there. I think you're quite right that there will need to be an examination of what happened and learn from that. But we're also making sure that we provide the right support to all the other nursing homes, that they're provided with the right guidance, the right practical support, the right PPE, and also the right moral support, because obviously they're the staff and the residents, they're in a very vulnerable situation. They're aware of what's going on, both here and in the United Kingdom. We are not the United Kingdom. What we're doing here for nursing homes and the residents there is completely different. For instance, in the United Kingdom, they're talking about sending people out of hospital with COVID-19 to the nursing homes. We're not doing that. We're doing the reverse. If people in nursing homes are sick and need medical care, they're brought into Nobles. And so I think the situation we've got here is extremely different to what people may see on the news about what's happening across.
And just in that case, would you consider, as consideration being given to testing widespread in care homes once we have a facility on Ireland?
Absolutely. What's happening at the moment, as you're probably aware, is the on-island facility should be going live this weekend. There is a strategy being developed for key workers to test them, but also we'll be looking at those really at-risk groups, the way that testing for the virus can be kept to keep them as safe as possible. So certainly that will be one of the considerations as we not only expand the number of tests we can do, but get them back a lot faster. Because at the moment we're waiting 48, 72 hours for a positive result, by which time you've lost that window of opportunity to intervene and stop the virus spreading and actually to treat that person very early. So I think you're absolutely right that all these will be looked into. The next person on my list is Amanda from Jeff the Mongoose.
Yes, thank you very much, Minister. The UK government has decided that the families of children with autism and learning disabilities can go out up to 3 times a day for exercise and travel to an area that suits their needs in a bid to help families manage their conditions. Will ministers allow families on the island to do the same?
I think we have to. I think that there are members of our community who need that extra space, that extra time. Again, lots of people have talked about rules. We do have some rules that we've laid down in legislation, but a lot of them are guidelines. A lot of them are trying to get people to do the right thing for them and their children. So I'm certainly aware that the Isle of Man has been trying to be far more inclusive for people with autism. Some of the cinema shows that were laid on at the Villa Gaiety, particularly for people with autism, were absolutely brilliant. And so we also need to make sure that they're included in our communities and treated as members of that.
Thank you very much. And for my second question, as the numbers of coronavirus cases rise, contact tracing remains a labour-intensive job for public health. If local tech companies or individuals with the appropriate skills develop a contact tracing app using consensual information from those who tested positive, would you use the information to feed the model, and have you spoken to any local companies about this?
I'm not intrinsically involved in that, but what I do know is that staff have been redeployed from other areas of government to back up public health in terms of the contact tracing. Some of this has to be done one-to-one because you're dealing with human fears and human emotions, and you have to give the explanation. But I'm also aware that this week, as part of the technical side of it and the backup, has been the online tracing so that we can build up far more data about who's involved, where they are and how they got it. And hopefully from that we can work, we have already been working with the private sector to develop that technology. I'm aware that various things have been going on in Southeast Asia in terms of tagging people and using GPS. We don't live in a surveillance state here, and I don't ever want us to get to that point, but certainly technology could be very useful for highlighting the risks to people if we get a local outbreak, and also in terms of contact tracing, making that a lot easier for people to remember what they've been doing over the last couple of days.
Thank you very much.
The next person on my list from Manx Radio is Tim Glover.
That's the my Minister.
That's the my.
The NASUWT has expressed deep concern to the Education Department, indicating it will not pay supply teachers beyond 14 days if throughput assignments have been cancelled due to the virus. They also allege the department continues to identify primary teachers for redundancy, and they're concerned about not having adequate PPE in these schools that are still open for the vital workers, saying that that is putting teachers and staff at risk. Do you share those concerns?
Well, I think Chris Keats, who's the General Secretary, shared those concerns with all Tynwald members. Actually, they were speaking from London, and the situation on the Isle of Man is slightly different. I mean, in terms of redundancies for teachers, no teachers are going to be made redundant. We do normally have a redeployment, but what we've done in the department is set up a peripatetic team because we're not quite sure when we're going to be able to get back to a sense of normality. Also, what normally happens during the summer is recruitment. And again, it's going to be quite difficult to recruit people from off-island to take up some of those vacant positions. So I can say now that no teachers will be made redundant. We'll be creating a peripatetic team. We'll be including them. The other criticisms were very much around PPE and having that for teachers if they were dealing with people who might develop the symptoms of coronavirus during the school day. What we've been doing is working very closely with public health about their guidance. Now, their guidance was actually that people didn't need PPE, but we've responded to the concerns of teachers, and particularly those who are teaching children with special educational needs. And so we are going to be providing PPE in terms of masks. We've never had a major issue in terms of gloves or aprons, but we will be providing a certain number of masks which we've procured ourselves. We haven't taken from the healthcare sector, which will allow those teachers, if they feel that they're in a risky situation, to respond to that. And I think one of the other issues is that on the Isle of Man, we have a number of teaching unions. We are trying to work with all of them to have a common way forward for this, to make sure that we keep the safety of staff and pupils as our main priority throughout this process.
And second question, we're getting very mixed views, as I'm sure you've already heard. I know you were on Man in Line earlier about the Comus Hotel being used, and I just take one quote, as a modern-day internment camp, being one description. Why are those been tested as positive on the island asked to self-isolate for 14 days and trusted to do so, whereas those who return to these shores from further afield are quarantined and they haven't tested positive?
Yeah, I mean, we had a long debate yesterday in Tynwald about this very subject, and I must admit, in terms of being in the Council of Ministers, this was one of the most difficult decision I've ever had to make in terms of closing our borders to residents of the Isle of Man. What we know is that those people who have been found positive, who are symptomatic and have got a positive test, have an awful lot of support to keep themselves at home. What we also know is that we've got people coming from an area of the world, which is the UK, which now has probably a higher density of coronavirus than even Wuhan back in January. And so the viral load that they're potentially bringing back to the island is far more significant. And so if we're going to maintain the trust and confidence for the Manx people, I think it is absolutely right that those 200 or 300 people are treated with the utmost care and precautions to protect the 85,000 people who are on our island. So it was a very difficult decision to make. We are starting the process today, and I'm very glad that we've started to get these people who want to be repatriated coming over. But we have to do this in an orderly, staged way, and also we will be reviewing this over the coming weeks as we understand more about the way the virus is spreading throughout our community. I think the next person on my list was Rob Pritchard from 3FM.
Good afternoon, Minister. My first question, you'll probably be sick of me asking this right now because I know I've asked it a couple of times before, but I'm hoping you've just provided a bit more clarity this time around with regards to people's education around exam grades. You've mentioned the last couple of times that the discussions have been taking place. Just for a bit of clarity, where are we with that?
Yeah, and I'm sorry we didn't give you a more specific answer in the past. One of the issues we've had is with the various exam boards have come out with various different answers as we've gone through this health emergency, because they're based in the UK. They've had pressure from Gavin Williamson, the Education Secretary over there, and we've now reached an agreement throughout the United Kingdom that we'll have a level playing field for both Isle of Man students and UK students, that those doing GCSEs or A-levels will not have to sit their exams, that they will have their awards given to them according to coursework, according to predicted grades. So that relieves that tension. However, there are those students who perhaps want to do their exams to prove themselves, to prove that they deserve better, or perhaps those who are being homeschooled who are in a very difficult situation. And so we will have the facility for people to take the exams later on in the year if they want to, perhaps October, November. And once we get those timings, we'll be working with teachers to free up some capacity to allow those pupils to actually get the grades they deserve.
In which case, with that, do you know when a decision will be made on those? And all the information you just mentioned there, where can people access that?
Okay. We've been sending all that information on to the head teachers of the schools. So if there are individual students who are worried about this, who haven't had that cascaded down to them, please get in contact with your head teacher. They'll be able to advise you. And if we've had one or two issues with various BTEC courses. So if you're worried about that, again, I've been working with the principal at UCM, trying to get that information out. If you have a look at the UCM website, there's an amazing amount of resources there for people on the effects of COVID is having on them personally, but also professionally and through their education. So we'll try to get that information out there whenever we can. And if people or parents have individual issues, get in contact with your head teacher. If they don't know the specifics, then they can contact the department and we'll get that information out.
Thank you very much. My second question, just regarding what was touched on before about schools reopening at some point in the future. Parents and carers out there are doing an extremely good job of trying to keep their children engaged, as you say, trying to find that mix between education and leisure, whilst also, getting the key knowledge they're going to need. There is going to come that point, though, where we move, as you say, in stages from homeschooling back into a regular school system. What preparations are you making to know where students are at with their homeschooling, to line it up right with when they go back into school, so it's A, a smooth transition, and B, that certain children may not feel left behind or underprepared going back into that?
No, absolutely. I think the teaching profession has done a remarkable job to adapt very, very quickly to a very strange environment, whereby they're having to relate their students by phone, by email, by leaving coursework for them and then following that up. And what we need to do as we gradually open the schools up again is do it in very specific stages so that we bring people along. One of the things talking to younger people earlier on today was they said, are you going to throw us in at the deep end? No, we need time for people to adjust, both staff and pupils, to what has been a lockdown for a couple of weeks. And so we're going to need to do that very gradually. We're also going to have to look at those people who are about to transition from primary to secondary school and make sure they don't lose out on that experience so that, again, their education isn't held back when we go further on in the year. So there is a large amount of work to do that, but I'm confident in the dedication and professionalism of the teachers we have on the Isle of Man, that they've really stepped up to these challenges and will continue to do so.
Thank you very much.
The next person I've got is Mark O'Connor from MTTV.
Yes, good afternoon, Minister.
Good afternoon.
Last month you mentioned about university students and assistance as being looked at to give to them. Obviously, many Manx university students are now in a sort of limbo period in terms of financial assistance, given the fact that most work at summer to supplement their studies. And we've seen, obviously, rightfully so, many workplaces and even the government STEP programme have been cancelled. Can you give any further update or any further assurances to Manx students who are quite rightfully worried about their future from September onwards?
No, absolutely. What we did, even for those students who'd returned home, if they were in receipt of a maintenance grant, we carried that on. I've also been in contact with the Treasury in terms of those Manx students who normally would get a job during the summer, who now can't because they're in lockdown and their normal businesses they'd work at aren't open. Any Manx student who's here for the summer, who's eligible, can apply for job seekers allowance. It's a means tested benefit, but they would be eligible to do that even though they're at university during the summer months. And we will try to work as much as possible with those students, again, to make sure that they're safe during the summer, but then they can hopefully return to finish off their degree after September. And
so so Manx students can right now apply for job seekers.
Yeah. Once they finish their term time, obviously they're here now. Quite a few of them. Once their term time is finished during the summer, they can talk to the benefits agency. They can talk. I'll get the telephone number for you on one of my bits of paper here. If I've got it, they can have a chat with the benefits agency. They can get advice, and they can apply for job seekers allowance. The Social Security telephone number is 685 656, and they can get advice there in terms of what benefits they can claim during the summer months if they're unable to work.
Thank you. And my second question, with your sort of doctor's hat on, we're seeing more and more countries around the world advising about masks. So some countries in Spain, Turkey, handing out masks to members. It's been a question that's been asked in every single press conference, but is there any update on masks provision on Ireland for members of the public?
I mean, mask provision for members of the public, it is a difficult one because what we're talking about is supplies. If I had a couple of container loads of masks, I might suggest that the police give them out on the streets like we've seen in Spain, but we don't. What we're doing is maximising those supplies for those people who need them the most, which is our frontline healthcare workers, who are at serious risk of developing this virus. Because what we do know is that healthcare workers, because of the load of the virus they can get being coughed over by by somebody known to have coronavirus, can significantly increase their risk of developing illness, irrespective of any preconditions they may have, irrespective of their age, which is tragically why we've seen so many healthcare workers dying in the United Kingdom. So we have to prioritise those masks. What I would say to people in the community is if you want to make your own mask, there's lots of resources online. Personally, from a scientific point of view, masks have been shown to reduce transmission if you've got it. If you're coughing and spluttering and sneezing and you have coronavirus, masks theoretically could stop you spreading it. But how they prevent you getting it in the first place is probably minimal. all it takes is for you to scratch your nose once while you've got a mask on, and that can negate any benefits it will give you. So I've got no problems with people wearing masks. I was served by somebody in ShopRite in Ramsey yesterday who asked me whether she was doing the right thing, and I said to her, if it makes you feel better, fine. But as a doctor, there is no scientific evidence at the moment that masks would help you stay safe. However, we're constantly looking at the reviews of that. We're looking at the World Health Organization, other jurisdictions. The CDC in America, for instance, have changed their guidance, but they were very much talking about transmission in a pandemic phase, in a very much a built-up area. We're different on the Isle of Man, so we can take better advice. But I don't think anyone laughs anymore when they see people with masks on the streets. Unfortunately, we've got the new reality now, and it's up to those people to make their own risk assessments.
Yes, so thank you.
The last person I've got is Chris Kay from Energy FM.
Good afternoon, Minister.
Hello
You
there.
talk of maintaining the trust of the Manx public. This whole issue of repatriation seems to be providing one problem after the other. What's your assessment as a government minister yourself on how this situation's been handled? I
think it's been, as I said, an extremely difficult decision to make. I think the situation has been handled well. I think we've given clear signals that we were going to close the borders. We gave clear signals that, irrespective of whether you're Manx resident or not, we would try to protect the people on the Isle of Man, but we would loosen that restriction when it was safe to do so. And that's exactly what we're doing now. Whether people agree with this or not is up for conjecture, and obviously those people who have been stranded abroad are very angry at this decision, but I think it was exactly the right decision to make at the right time. And as we get more data in terms of the prevalence of the virus on the Isle of Man, we can review that decision and move forward.
Well, it's interesting to hear you say you think it's been handled well. It won't just be people who have been stranded off island who may be angered by how you've handled it. There are many people who are adhering to the measures laid down by government who may now be staying home in a flat or apartment with no garden. They may be self-isolating, as you've already mentioned, if they have tested positive for COVID-19. Can you see why they would feel aggrieved then that those who may have chosen to ignore the rules, and granted there will be those who haven't deliberately ignored warning that the borders were closing, but they are now what they view as a discount stay at one of the island's best known hotels with plenty of exercise space?
I think people need to be realistic that we need to try to bring these people home, but we need to do it in a safe way, both for them and the rest of the population. So quarantine was the first thing we thought about. Now, whether you quarantine people at home or whether you quarantine people in a secure facility has to be assessed in terms of the risk those people pose. As I've said, we've got people coming back from the United Kingdom or further afield. We don't know their risk. We don't know how much of the virus they're carrying with them. And so I think putting them in a secure facility in a humane way, showing compassion, is the right thing to do. However, we will look at that policy as it develops over the next couple of weeks. But in terms of people who are abroad, who may be looking at this, who are in perhaps a holiday home that they have in Spain or Portugal, my advice would still be, if you're safe where you are, stay put. To actually come through the United Kingdom at the moment, at a time when the pandemic is on the rise there, puts you at risk. So if people can stay put and stay safe, I think that's the best thing for them.
Look at this situation and you'll look at it in the coming weeks. Surely you can't move the goalposts again now they've been set. It'd be unfair to those who are coming in and being repatriated at the moment.
I think it's quite fair to constantly reassess what we're doing. In terms of policies, the information we're getting has changed on a day-by-day basis. So as we've already shown, we're looking at the medical evidence, we're taking the advice from the clinicians, and then getting the right political policy to drive that forward. So the rules today are the rules today. Those are the best ones we can come up with, and we've got the evidence to support those. But within a couple of weeks or a month, we may be able to relax some of the restrictions we're doing, whether that's borders, whether that's people going out, whether that's employment. And we need to do that on a constant basis as the situation develops. So whilst we're deciding the best policy we can, we're also very realistic that we need to re-evaluate that as things change.
There are all sorts of predicaments people find themselves in, though. There were Manx residents in New Zealand, Australia, the other side of the world, and able to make it back in time before the border closures, or couldn't afford the hiked up fares that were being charged. They may have forked out lots of money to get back onto the island, and they know they may indeed be allowed back in if they meet that criteria. They're being asked to pay up to £1,000. It's a question that's been asked before, but I'm afraid I don't think the public have had a good enough answer to it.
Okay.
How did the Council of Ministers come up with that figure?
The figure was originated because we were trying to put a cap on it. When you look at the costs of a hotel room and 3 meals a day, they can be a lot of money. So we tried to put an upper limit, a cap on the amount of money people would be expected to pay if they could. But we've also made it quite clear that those people who can't pay, or those people who are already on benefits, that will be subsidised further by the government and by the taxpayer. If I can come on to Amanda, I think you wanted another question.
Yes, thank you. We'd just like a little bit of clarity about the coronavirus data. Yesterday we were told by Dr Magson that we could be able to work out where we are on the curve on the 23rd. Yep. But you said recently, I think it was today, that you believe we'll peak in 7 to 10 days. What has changed since yesterday to make you say that?
Nothing. I mean, when I'm saying 7 to 10 days, that's around about the 23rd. So we haven't got any exact figure. Around about 7 to 10 days, we'll know where we are in terms of the peak. And again, there's been lots of people talking about various aspects of testing. The reality of everything we're doing as a government, every policy, whether it be borders, whether it be social distancing, whether it be closing schools, is to stop the NHS being overrun. We've seen the pictures of Italy. I've talked to clinicians working in our hospital who do not want that on this island, who do not want to be seeing their colleagues falling by the wayside next to them. And so all the efforts have been done to try to preserve Nobles Hospital, the staff there, but also prevent avoidable deaths. If we get people coming in that we can't ventilate, that we can't treat with oxygen, that we can't rehydrate, they will die, whatever our best intentions are. So despite looking at all the figures in terms of the numbers, we're also looking at the figures of those people who are coming into hospital, the numbers that are coming in, to make sure that we can control that by expanding the facilities there, and also critically the number of people who are in intensive care who need those very precious beds and very precious ventilators when they get so extreme that they can't breathe for themselves.
Thank you.
Tim, you wanted another question.
I feel like I'm at school with my hand up.
So
Actually,
I'm sorry.
A human question. Do you know how the medical staff at Nobles Hospital, who are of course dealing with this COVID-19 outbreak, are doing? I mean, it must have been awful for them with what they've been facing over the past 24 hours. Yeah. How are they being looked after?
I don't think anyone is prepared for this, and one of the issues we have, me and you standing here virtually, putting our hands up to ask questions, we're living through a phony war. What the real essence of what we're trying to do is on the wards at Nobles, is going through the intensive care unit there, is going through the emergency unit. When you go there, and I had a chance to visit, and you see people in the full PPE. Looking after people who are gasping for breath, you realise the reality of this. We don't show those pictures, and we shouldn't, because those are people struggling for their lives, and I never want to see those pictures in the media, because that's a very private struggle. But that's the reality. What I have seen from the medical staff that we have is a really concerted, dedicated and compassionate commitment to get this right. They've redesigned the emergency rooms, they've redesigned the wards, they've changed their roles, they've retrained to be able to work ventilators. There's a huge amount of solidarity there, even at a time when not only are they looking after critically ill people, but they're concerned about their own health and getting it themselves. They've seen the news, they know what happens across, and also they don't want to take it back to their families. So there's an incredible amount of dedication there, and really in terms of the support, despite things like staff welfare offering counselling and a whole range of other mental health and practical things we're trying to put into place. I think the main thing is that the staff at Nobles and staff throughout our healthcare system know that we're behind them and we're completely supporting them. So certainly I hope you'll join me on Thursday when we come out and clap for them, because I think that solidarity, both for the healthcare workers but right across all our frontline workers, is really important. Because as Catherine Magson said yesterday, the health service is one aspect for this. The only way as an island we're going to get through this is as a community. Without community we are nothing, and I hope that this will actually show the importance of the community we have on the island.
Thank you.
Were there any other questions? Sam?
So, just in terms of the number of people who are being sent to prison for breaking the COVID regulations, we're currently up to 6 of them now. Do you have a bit of a clear idea in terms of what's happening when they go to prison to prevent this becoming more prevalent inside Germany itself?
Yeah. I'm certainly aware that the social isolation in terms of prison has been stepped up. You've got to be very careful, because what we don't want is the same situation as in other places where people are just kept in their cells all day. You need that compassion. You need to be able to allow people to exercise, but in a safe way, that they're not going to get the virus. Because in the same ways we've seen in other jurisdictions in terms of their nursing homes having outbreaks, we've also seen the same with prisons. And these people need to be treated humanely. They're sent to prison as a punishment, not for punishment. And we've got to keep them as safe there as possible. So I know the prison governor and the staff there have been doing as much as possible to keep people socially isolated, but to make sure they don't literally go stir crazy in their cells, and make sure that they're allowed to go out for exercise. They're allowed to at least have some resemblance in terms of education, rehabilitation at the same time. Okay. Well, if that's all the questions, it's become a bit of a custom to celebrate the amazing generosity of our people at these press conferences, but I'm not sure where to start, because there's so many of you out there stepping up to support our island. People have been doing shout-outs, so I suppose that this first shout-out, seeing what we've said already, goes out to all the housekeepers at Nobles Hospital. We've been concentrating on the medical staff, but we need the housekeepers, we need all the support staff to keep our hospital open and to keep our health service running. We've also received nominations for Howard's Heroes for everyone who works within the Department of Health and Social Care's community services that continue to provide care and support through adult services, the reablement team, home care, social workers, indeed everyone working hard to ensure our community is cared for and supported at this difficult time for all of us. The team at the Isle of Man Government Technology Services are keeping us up to date with the statistics and news and all the updates, and I'd like to thank them for that. And a further shout out goes for our delivery people, including the Isle of Man Post Office, Greylaw and Manx Independent Carriers, who have kept the supply chain going. The banking sector, who have kept their branches open and are providing support during these extraordinary times. And to the Creer family and all those farming families in the island working hard to keep us supplied with local produce. A very deserving shout out is for Watson's Nurseries, who are delivering free plants to people at risk, anyone elderly or immune compromised, to help them see beauty when they could be mentally struggling with the lockdown, particularly if their gardens are their lifelines. And I'd like to thank the Manx Sewing for Safety group, which links people in their homes and has produced over 800 kit bags and shoe bags for community healthcare workers, frontline staff, prison officers and porters, so that they can keep their families safe when they change and come home. Whilst working on their own, they've combined with the work at UCM to make scrubs and are showing the real Manx spirit which will get us through these difficult times. And finally, a shout out has to come in for Rachel Quayle, a nurse on ICU who spent her birthday this week working a 12-hour shift at Nobles Hospital. I'd like to say thank you again, stressing the importance of the social distancing and how this saves lives. The weather may be improving, but now is not the time to venture out. This is not the time to take risks with your own lives or the lives of others. Stay at home. It's very tempting to start a new hobby or DIY project, but please do so safely so you don't risk an avoidable accident that could end up with you needing the very emergency services we are trying to protect. We must not let our guard down. Be safe, stay at home, save lives. Thank you.
global pandemic of coronavirus is without doubt the gravest threat we have faced both as an island and as a nation.
We are working hard to help our island as a community, but we are asking you to help us to help you.
For your island, for your community, stay at home.
For your island, for your community, stay at home.
For your island, for your community, stay at home.
Stay at home.
Stay at home. Stay at home.
Please stay at home.
Protect your community. Stay at home.
Stay at home.
Stay at home.
Stay at home. Please stay at home.
Stay at home. For your island, for your community, stay at home.